Delegation takes skill and good leadership. Are you a new nurse having a hard time to find your voice? Were you surprised to know that your RN position would entail a supervisory role right from day one? It doesn't have to be scary and it doesn't need to be difficult. It just requires you to understand your role in this responsibility in order to guide others in theirs. Delegation and supervision, two very important words in a registered nurse's world. To delegate is to provide tasks to an unlicensed person who you know has the right qualifications to perform them. Supervision is not to be confused with micromanaging. As an RN, we are still periodically monitoring the delegated task and person performing it because at the end of the day, you are still responsible as the RN. Let's take a look at the rules regarding delegation for the state of Virginia. The RN must have assessed the patient population, identified the priorities within the unit, established sufficient supervision and the licensed staff to supply safe nursing to the patients, and delegation has been communicated appropriately, aware of the educational requirements of the unlicensed staff, and that the staff has provided the appropriate resources to perform the tasks. Please remember the 5 rights of delegation: the right task, the right circumstance, the right person, the right supervision, and lastly, the right direction and communication. The only time an RN can delegate tasks are if the task delegated will be done safely and do not put the safety of patients at risk. The RN will still be responsible for the patient and all of their needs regarding their assessment, planning, evaluation, documentation, and the supervision of said patient. The nurse is competent and knowledgeable relating to the skills being delegated, and the RN provides clear communication that is client-specific to the task that is being assigned. The unlicensed person to perform the task is wearing a name tag that identifies them to the patient as being unlicensed. And remember, one unlicensed person cannot delegate to another, so it is important to train the staff so they understand this. Virginia's legislative and information system states that before anything can be delegated to an unlicensed person, the RN will have had to have performed an assessment on the patient. The nurse must understand the baseline status of the patient in order to decide if an unlicensed personnel can provide any of the care required. Additionally, that delegating nurse must understand and be competent of the skills, the training, and experience of the unlicensed personnel. The nurse must be confident that the staff member is able to provide safe care to the patient. As long as you put all of those pieces together and do this the right way, delegation can happen so easily.